my name is Martti Färkkilä. I'm Emeritus Professor of Gastroenterology at Helsinki University Hospital. Together with Professor Annika Bergqvist from Karolinska Institute, Sweden, and Professor Cyril Ponsion from Amsterdam Medical Center, we did a study, surveillance of PSC, comparison of scheduled or on-demand ERCP with annual MRCP surveillance. Primary sclerosing cholangitis is associated with high risk of hepatobiliary malignancies, especially cholangio cancer. At present, there are no good tumor markers for screening of cholangio cancer, and current recommendation of PSC monitoring are mainly based on empirical opinions. The optimal strategy to assess disease progression and screening for cholangio cancer, the main cause of death of PSC patients, is still unclear. We aim to compare 3 different surveillance strategies and their effect on patient outcomes. We collected data from 3 distinct PSC cohorts with different surveillance strategies: scheduled ERCP based on individual risk stratification, annual MRCP surveillance, and on-demand ERCP according to current ESL guidelines. The composite endpoint consisted of hepatobiliary malignancies, liver transplantation, or liver-related death. In total, we included 1,600 patients. The cumulative incidence of the composite endpoint was lowest in the group with scheduled ERCP. Also, the cumulative incidence of cholangio cancer was lowest in scheduled ERCP group compared to others. In conclusion, in this large multicenter study, we demonstrated that the surveillance strategy based on scheduled ERCP and individual risk stratification compared to current clinical guidelines is associated with improved overall prognosis and a significantly decreased cumulative incidence of cholangio cancer. This reduction is attributed to systematic screening for biliary dysplasia using brush cytology and timely liver transplantation before development of cholangio cancer. Additionally, we demonstrated that this strategy is also associated with the lowest rate of fibrosis progression and improved outcomes over time. Based on these results, the role of ERCP in PSC should be re-evaluated. Thank you.